developments in the past week that we will appreciate to share with you today. Firstly, as the province of KwaZulu-Natal, we welcome the announcement by President, His Excellency President Ramaphosa, that this year's local government elections will be held on the 27th of October 2021. This has put an end to much speculations and widespread concerns over whether the elections were going to take place at all, given the massive disruption caused by COVID-19 pandemic. These local government elections will also mark the 21st anniversary since the establishment of a local government system in our country. And this will be the 21st anniversary. The upcoming local government are important as they represent the maturity of our democracy. As the province, we will use the upcoming period to reflect on the journey and the progress made in improving the landscape of where our people live. We will identify areas where corrections are required and use the accelerated district development model to address our citizens' concerns. It is extremely important that as many eligible citizens as possible participate in this all-important process. Another development related to the Freedom Day celebration. We are looking forward to commemorating the 27th anniversary of the country's first democratic elections in 2 days' time. In this regard, we will be hosting our own Provincial Freedom Day celebration at Uhlange Institute on Tuesday, 27th April. This year, we will be remembering Mayor Charlotte Maxeke and Dr. John Langalibalele Dube, both of whom would have turned 150 years this year. This is a generation that planted the seed that have germinated into freedom that we are enjoying today. Although some challenges still do exist, we certainly have a lot to celebrate and not to take for granted as a nation, particularly our socio-political freedom, which was achieved through the sweat and blood of many heroes and heroines of the people of South Africa. The official gathering to celebrate the Freedom Day will be held in strict adherence to COVID-19 regulations. With regard to the update on COVID-19 status quo, the province of KwaZulu-Natal continues to rank the second highest in terms of the number of laboratory confirmed cases countrywide, contributing 21% of cases. The average number of cases recorded in the past 7 days declined to below 100 cases per day. The province continues to rank the fourth highest in terms of fatalities countrywide, following Eastern Cape, Gauteng, and Western Cape. We have continued to observe a decline in number of new cases recorded weekly. The overall percentage change in number of new cases between week 15 and 16 was a decline of 8%. The actual number of new cases was 606 for week 15 and 555 for week 16 respectively. The overall provincial incident risk remained at 5 cases per 100,000 population. However, King Cetshwayo and Hirikwala, as well as Uthukela districts, observed an increase in the number of new cases. In fact, King Cetshwayo and Hirikwala districts observe a percentage change of more than 50% in the past week, which is a concern for all of us. The number of hospital admissions has continued to decline, in keeping with a reduction in the number of new cases. The province currently has 444 COVID-19 patients admitted in hospital, with a recovery rate of 96%. With regard to the vaccination program, the Sisonke Johnson & Johnson study, also known as Phase 1A, will resume soon and is expected to end on the 30th of April 2021. Phase 1B will commence on the 1st of May 2021 and end on the 16th of May. Since Phase 1A of the vaccination process began on the 18th of February and until its voluntary suspension on the 12th of April, the province of KwaZulu-Natal had vaccinated a total of 51,615 health workers at 91 sites throughout the province. This was made up of 37,457 health workers from the public sector and the remaining 14,158 from the private sector. As part of Phase 1B, if the adequate number of vaccines is received, to vaccinate the remaining 81,238 public health care workers over 7 days, we could meet a provincial daily target of 11,605 workers. Vaccination for Phase 1B and Phase 2 will run simultaneously. For instance, we will be vaccinating essential workers age 40 and above, and at the same time, as we vaccinate people in congregant settings and those with comorbidities, or those who are age 18 years and above. An incremental approach will be used when dealing with Phase 2 and Phase 3, with the number of vaccination sites getting increased as the program is scaled up. The KwaZulu-Natal Department of Health has already identified mass vaccination centers such as the Royal Showground for Umgungundlovu District. For eThekwini, we have so far identified Pinetown Civic Center, Kings Wellington Sport Ground, and Ketomena Sport Grounds for the South Central. Hospitals and community health centers will act as primary vaccination centers, while clinics and other community structures will be the secondary vaccination centers. The community structures that will be utilized as vaccination centers have been mapped per district, and all information in this regard will be made available. With a provincial daily target of 30,000 vaccinations for at least 5 days per week, the Phase 2 vaccination could be completed by September 2021. This will create an opportunity for us to commence Phase 3 earlier in October 2021. Phase 2 of vaccination process will then start on the 17th, as we indicate, and will cover essential workers, people who work in settings where they interact with a high number of members of public, those who are over 60 years, and those who are with comorbidities. Our target for Phase 2 is to vaccinate at least 2.9 million by October of this year, with Phase 3 expected then to begin in November. We have an army of 7,616 people who are trained to carry out these vaccinations, and we are confident that with the requisite support and cooperation from the public, we can indeed achieve these targets. We have outlined the table here, which we will provide in our statement. And the table covers the workers that are targeted or are a target between May and October. And then it deals with all categories as I've already unpacked. We want to emphasize the importance of registering for vaccination. The success of our vaccination plan, which will help us to achieve enough population immunity to be able to halt the spread of the virus, depend critically on as many people as possible getting registered on the electronic vaccination data system. We understand the dynamics of our province, and that many who are 60 and above will require hands-on support to get registered. We are urging relatives, children, and friends of the elderly who have familiarity with technology systems to assist our grandmothers and grandfathers. Ogogo nomkhulu masibalekelele ukuthi ba-register. As the province of KwaZulu-Natal, we are directing that the coming weekend be the weekend of heightened registration for vaccination. To this end, we will be visiting various districts where we are champions to monitor and assist in the registration of the elderly, especially as the critical contingent. The self-registration system for people above 60 years is now live since the 16th of April. Those that cannot self-register will need to be supported, and in this regard, the department will utilize all municipal offices to register, but will also use mobile clinics, school health teams, community health workers, community development workers, agricultural extension officers, environmental health practitioners, traditional council secretaries, and other categories of workers will assist in registering community members as part of support to the vaccination program at the district and local levels. Training material on the electronic vaccination program include a tutorial video that has been circulated to district, and staff training commenced as well on the 19th of April. We are quite concerned about complacence. We have noted with a great sense of worry various forms of behavior that indicate a high level of complacence, especially when it comes to adherence to COVID-19 safety precautions. Far too many people seem to have lowered their guard. They are no longer wearing their mask in public, and many are carrying themselves they carry masks for just compliance. There is no social distancing, let alone regular hand sanitization or washing of hands with water and soap. People are gathering in large groups, especially at restaurants, pubs, nightclubs, and taverns. Some shops are even allowing more people than required numbers, while others seemingly don't bother to have hand sanitizers at the door. The curfew times are also no longer being respected in some instances. We seem to be sliding back to the kind of complacence that consumed us toward the end of last year, just before the second wave came and ambushed us. We plead with the citizens of the province to remember that once bitten, twice shy. As it happened with the second wave, the third wave will not announce its arrival. Yes, the numbers may be low at a moment, but COVID-19 is still with us and is killing the people. As of today, the province of KwaZulu-Natal has recorded 10,369 deaths since COVID-19 started. We remain concerned that our province continues to rank the fourth highest in terms of fatalities countrywide. The Department of Health is monitoring resurgence indicators, which will alert the province to respond accordingly if there are spikes or signs of a resurgence of COVID-19 in the province. If we are to avoid the calamity that we saw in December and January, we must start today and behave as though the third wave is already here. It is not enough to think that because you know and trust someone, then they are not infectious. It just does not work like that, and we have seen so. So we continue to see these challenges, and let us also take lessons of what is happening in other countries. As we speak, the subcontinent of India is in deep trouble due to a resurgence of COVID-19. We are seeing in other countries people are scrambling for life-saving oxygen supplies, beds, and medical drugs. Patients are dying outside hospitals. On Friday, we observed in India that the country's overnight infection total was higher than